welcome
We're
back.
back.
Welcome back
Yes,
to
yes.
Open Your Eyes, and we're moving now into our second segment for the morning. Now, this is a very important conversation. We are at a point where some folks might not know what's going on with the COVID-19 pandemic. Some folks might just know a lot, and they ask the question, what's happening with COVID?
Yes.
Now, in to talk to us more about it, we've got reps from the Ministry of Health. We've got Ms. Myra Pinelo-Fernandez, National Surveillance Officer, Epidemiology Unit at the Ministry of Health, and also Dr. Natalia Beer. She's in with us, Technical Advisor for the Maternal and Child Health Care at M.O.H. Guys, good morning and welcome.
ladies.
Morning.
All right, so there we go.
So, for Dr. Bear, one of the key questions, we keep getting the news updates, right? We see them on the government press, we see them on the media and so forth when it comes to active cases, people that are that they have the COVID-19 virus, but we also tend to kind of put it on the back burner because now all regulations and restrictions are out, right? So now everybody is just doing a free-for-all. So can you give us the latest statistics on active cases, people that are being hospitalized, if there are any deaths and so forth? And please feel free to speak candid about these situations.
Ms. Pinelo? It's Ms. Pinelo.
Yes. Yes, no problem. In terms of deaths, we have seen a decrease, of course, because one of vaccination status, and two, because we are at a point where we are seeing a decrease in cases or transmission of COVID at this point in time. So just to give you an overview of our deaths for the past, since the beginning of the pandemic, we see, for example, in the month of June, we have only had 2 deaths as compared to the beginning of the year. In February, we had 29 deaths that were registered.
Wow.
So that has been a big decrease for us. In April of this year, we did not have any deaths recorded due to COVID. So for us at the ministry, really, it is, in terms of numbers, then we are looking at a really big decrease when it comes to deaths. When it comes to hospitalization now, for the beginning of the year in January 11, for example, we had 20 persons hospitalized and 3 of those persons in the intensive care unit. Presently, up to yesterday, we had only 3 persons hospitalized and nobody in intensive care unit.
All right. So let me get to Dr. Beer. Dr. Beer, what's the situation, the current situation in the country with respect to the pandemic? We know that the BA5 has been detected in the country. What's the current situation, the status as we speak?
I think Dr. Diaz, our Director of Public Health and Wellness, have shared earlier in an interview that the majority of the samples that were tested for sequencing, the BA5 is confirmed in Belize, and at that moment, well, BA2 was the one that is most common, but we have both circulating currently in Belize, BA2 and BA5.
And with respect to not hospitalization, but when it comes to the duration of contagion and from whence contracting the virus to testing negative, how are we there? At the onset of the pandemic, it was about 2 weeks. Where are we at this point?
I think the measurements that the government have put in place depends on the data, precisely like what Ms. Pinelo is sharing with us. Based on the data is how we make decisions. So a lot of the public health measures have been lifted, but the virus and the SARS-CoV-2 virus in the different variants are present in Belize, so we can't forget that. So the individual responsibility continues to be one of the cornerstone of the dealing with the pandemic of the COVID-19. So although it is not mandated that we use face masks, we still encourage, use your face mask as much as possible. Avoid crowds, Physical distancing is one of the most difficult things to comply with. So if the infected person, even asymptomatic, have on their mask, and the next person that is not infected have on their mask, the transmission is almost nil. And we have been saying this from the beginning. So although they are not seeing the number of cases that we saw during the Delta wave or the Omicron wave, the risk is always there, and especially if you are not vaccinated. We shared a few weeks ago the risk of complicating and dying from COVID-19 is 24 times higher among unvaccinated persons.
When you talk about vaccination, Dr. Bear, can you give us an update on vaccines? And have we received new Pfizer vaccines, new Moderna and so forth vaccines in the country? What about boosters? And can you give us also an update on the children's vaccine as well, and how many people are actually getting vaccinated?
Yes, well, the government of Belize continue to seek support from countries that can donate to Belize COVID-19 vaccines. And we must big up the Ministry of Foreign Affairs supporting the government and the Ministry of Health and Wellness to access vaccines. To date, we have 227,786 persons with first dose, and that is equal to 52.9%. And second dose or complete primary series is 218,276, and that put us at 50.7%. Not where we would like to be today, but so we have 25% more that we need to get vaccinated. For the children, 5 to 11, the target population is 73,000. And so far we have 11,000 or 15% that receive first dose, and 5,687 who receive second dose with 7.8%. So we are pretty low with kids 5 to 11. We want to encourage parents to make much of the summer break to get their kids vaccinated so that they can be protected before the beginning of the new school year.
And let's talk about how they're able to go on out to get to take their children to go and get vaccinated. Do they just go to a site? Do they have to make an appointment? What do they have to do? Parents, what do parents need to do to take their children for a vaccine?
Yes, for parents taking their children to get vaccinated, and for any other person interested in getting vaccinated, there is no need for appointment. One just need to show up to the vaccination site nearest to their home, and then they will get vaccinated there.
Let's talk about testing. Are people going out to get, are we seeing a lot of testing being done? There are mass gatherings across the country. There are no restrictions at this particular point, but the numbers aren't as high as we used to see it. What do you think is going on there?
In regards to the testing, well, testing is available at all hospitals and at the primary care facilities, and those that have the flu clinics open. The test is readily available. And yes, the numbers are not that high right now, but the test is available. So anyone that feel that they may come in contact with a positive person or have signs and symptoms compatible with COVID-19, the test is readily available for them.
As we're seeing the cases kind of fluctuate up and down depending on the amount of mass gathering that is taking place in the country and so forth. Do you think that with another variant or another strain of the COVID-19 virus that there would be a need to place regulations once again on the country, especially at least with the mask mandates?
There are, we use data to make decisions, so it's uncertain at this moment to reply to that question. I would say no, exactly, no? We have to wait and see how the epidemic, the pandemic behavior in Belize using the data. So if we continue getting vaccinated, the less we can expect to go back to those public health measures, some of them more drastic, and people don't like it, but we have to think of the population and how to protect them. So again, individual responsibility. This is a disease that is transmitted from person to person. So every person have to chip in with maintaining physical distance, difficult, wearing face masks, getting vaccinated.
How often does the Ministry of Health consult with various other ministries, for example, Ministry of Tourism, Ministry of Education, and so forth, just to give them that insight on where we are with COVID-19 and perhaps to help them make decisions for certain large events and large gatherings?
I think the one of the good things that Belize have in place is that the decisions on COVID-19 is taken at the highest level. No? Again, we use the data that is shared at the level of the cabinet, and all the different sectors, ministries are represented there. So everyone is participating in that decision making. So I think that is it's good, no?
Yeah.
All right. Let's get Myra once again back into it. We are looking at some of the charts that that were sent to us, and COVID-19 cases in the Belize district seems to be higher. Tell us where we could find the most cases and where we're seeing a stabilization of things, or if there's a rise in different districts. Can you share that data with us, please?
Do you have the graph that I showed it overall in terms of where we are in the wave? Can you share that one first?
All right. So we'll be getting that up for you in just a few. But we know that people will be flocking to various areas of the country, and it happens on a weekly basis.
Yes.
Whereby people go maybe home to Toledo or to work in Corozal, but they might not know what the data is showing in these areas and how to carry themselves. Because some folks might say, I don't want to wear a mask, man, or I'm not around a lot of people, when in reality, we should all be wearing a mask. So let's talk about that data. We'll be sharing that with you in just a few. As soon as
what we're seeing, if we look at the data for yesterday, we have a total of 19 new cases, right? But we also see that the cases are really, if we look at it in terms of total numbers or whole numbers, we are seeing Belize City and Orange Walk as the two districts with the highest number of cases reported. But when we look at it in terms of the rate of transmission, we're seeing that the Belize district is really not, has passed that threshold in terms of we looking at the numbers of people being infected per se. So we are looking more at districts like, for example, Corozal, and we have Toledo districts where we still see an increase on what we would consider normal when it comes to looking at the data statistically as opposed to looking at it on a whole or on a daily basis. But to add to it and to what Dr. Beer had mentioned, really we cannot forget our public health measures that can never be understated. I mean, people have to keep reminding themselves that it doesn't matter how high or how low the cases are in these areas, they have to protect themselves. So again, like what Dr. Musa mentioned in an interview, I mean, we have to be cognizant of the fact that we have to be responsible for what's going on in our surroundings. So if we're in a crowded area, of course, we ensure that we wear a mask, or make it a habit to wear a mask when we enter environments that are enclosed, as opposed to having to wait for government to say, you need to do this, you need to do that. So really, it's more of a personal responsibility at this point in time. We monitor the data based on information that we receive, but might not always be a true representation of what's happening out there.
Right.
And similarly, we're seeing cases, for example, we might see 24 cases in Orange Walk, but we might see maybe 8 cases in Stone Creek, but maybe these 8 cases are clustered in one specific area and really not widespread. So there is always more to data than what we're just looking at. So again, it's just to give the public an idea as to what is going on in the country, but at the same time, it comes back to personal responsibility.
Yeah, you're totally right. I'm looking at the data for from 1st March 2020 to 22nd July 2022, and I'm seeing the fourth wave with some serious levels. But the fourth wave is actually way less and nearly around the same level as the third wave. Even though that we're totally open, where everybody could go everywhere. This seems like there is a certain or a different pattern with the virus as we speak. Can you elaborate more on that for us, please?
Do you remember the question you had asked Dr. Bear in terms of incubation period for the disease?
Right.
Yes.
Well, really, the graph helps us to tell a lot about what's really happening.
Okay.
When we look at the beginning of the pandemic and when we had the original COVID, we're looking at incubation periods really being wider, 7 to 14 days.
Yes.
But as the variants came, we saw the incubation periods really decreasing. So right now, looking at the data and what we're seeing is really we're seeing shorter incubation periods, 3 to 4 days, and we're also seeing people getting reinfected faster than before. So really, what we're seeing right now is, yes, we just finished our one peak. We're really to the point where we could say that we are in a downward trend. But just like how we're at a downward trend, it seems as though the transmission does not stop, and we start another one.
Yeah.
And if you notice, the peaks are getting higher and they're also getting shorter.
Yes.
Yes.
An hour, as opposed to the other ones that are more wider. And again, that reflects in terms of incubation periods. So they really, it's getting shorter and shorter, and incubation periods are getting shorter. So hence, again, the transmission from person to person, and again, personal responsibility is what we have to keep reemphasizing or stressing to the public, because if I'm wearing a mask, but you're not wearing a mask, then really I'm not doing anything.
Yeah. You said something very important there in terms of reinfection, and I'd like to go to Dr. Bear with this one. If I was, if I tested, I had the virus week before, and this week I tested negative. When can I go in? And maybe I haven't received my booster, or I maybe have received my booster. If I am somebody with underlying condition, at what point can I go in for my second booster?
The booster, we are recommending 3 months after receiving the first booster. You get the second booster.
Okay.
And let's say I was infected with COVID right after the 3 months again, and I need to take the second booster. So when would be a good time for me to take the second booster after I've already been infected with COVID?
Yeah, the recommendations still stand. When a person have COVID-19, they need to wait 1 month to get vaccinated, be it first dose, be it that they meet the timing for the second dose, be it first booster, or they met the timing for the booster.
Okay.
So 1 month after, they need to check with their healthcare provider if they're ready to receive first, second, or booster.
Speaking of booster, the last time, well, I could remember having a conversation with the ministry. We were at the point whereby we were trying to get people to go on out to get their second booster. We're talking here frontline workers, we're talking people with underlying conditions, and people 60 years and older. Is that the case now, or anybody at this particular point who've received a booster, are they able to go on out to get a second booster?
Well, we're encouraging persons, as you mentioned, older than 60 years, persons with underlying conditions, healthcare workers, but we are not denying for any person showing up requesting booster dose.
All right.
And those are available at all of the vaccine
Sites.
All right.
All right. It sounds like clarity there. And that's one of the, these are some of the questions that folks have been asking because they just want to know.
Yeah.
Now, also, Dr. Bear, there are some folks who may have had the first dose and just said, you know what, I am not going to take the second dose. Notice that somebody in the family might have dropped with COVID, got severely ill 6 to 8 months afterwards. Am I able to go and get the second dose? Would it still be a second dose, or am I starting fresh all over again?
There is no clear recommendation right now for restarting the vaccination. So we would count it as second dose, and we would highly encourage for them to get booster doses.
All right. Well, I think you've you guys have definitely relayed clarity for us with respect to this pandemic. Is there any other thing that you'd like to share with us with respect to COVID?
I would like to encourage the population. There are some diseases, like COVID-19, where the evidence is there. If you are vaccinated and you get infected with COVID-19, the disease will behave mildly. You may have symptoms or you may not have symptoms. And if you have symptoms, it will be like just having cough and cold. But nonetheless, it is COVID-19. And COVID-19 is not like a common cough and cold. It's present in many organs in the body. And so why expose ourselves to that now when we can be prevented with vaccines? So, and the next issue I would like to remind the public is that we have been blessed in receiving donations from countries, and we have enough vaccines right now to vaccinate almost 100% of children 5 to 11 years.
Okay.
This vaccine will expire in September, so we have a little bit of time. So that's why we're encouraging the parents to please come out and get your child vaccinated before the beginning of the school year. Children will be in school. Maintaining physical distance among children is difficult. Wearing face masks, I'm sure every parent will encourage their child, but children are children and they want to be close to their peers. So if you vaccinate your child before the beginning of the school year, then you have a better chance of not getting infected in school.
Totally. Dr. Bear, I can't let you go without asking about the current situation that we know is very close. There in Mexico, as a matter of fact, in Quintana Roo, Mexico. We're talking about the monkeypox. We've seen a case there in Jamaica. So we know that it's starting to surround us. What is the ministry doing at this point to try and safeguard us here at home?
I think the most important thing, and Ms. Myra could expand on this, the surveillance system. We need to train the staff in public and private, which we are doing, on how to identify the cases and to strengthen the surveillance system. And that is what will help us detect the first case and contain and apply the different public health measures to help reducing the risk for spread.
I could remember also at the onset of the pandemic, we had a representative, if I'm not mistaken, you were on as well, but I think, or as a matter of fact, no, it was Dr. Manzanero. But Dr. Bear, from your professionalism, would you classify us here at home with the monkeypox situation that's going on across the world now, if or a when situation? Are you able to tell us if you feel if it's an if we get it or a when we get it?
Well, if we have no flights to Belize and no persons from abroad entering the country, we would be in a better position. But every flight is a risk of someone coming in with monkeypox, and we fly a lot, folks, no?
Yeah.
So it's a win.
It's a win.
It's a win.
I would just like to add it's a win.
Okay. All right.
Well, you heard it here,
Just
folks. Yes,
just
go
to
ahead.
add to what Dr. Bear had mentioned in terms of monkeypox, yes, we have our surveillance teams and focal points within the regions that rapidly respond to any type of rumors. Recently this week, we had a rumor really that we had to act upon, and we have the support from our director, Dr. Musa, and has always been there with us to support, and we responded quickly, and so far, information that we got is really that of a chickenpox case as opposed to anything else. So it's something that has to be monitored, but yes, we have the teams there ready, and we could say that we are not 100% ready, but we are more than halfway there.
Yeah.
And the initiatives have started already. The trainings within the regions have already started. And so we are better prepared than we were probably when the pandemic just started for monkeypox in the other regions of the world.
Yeah.
That's
Well, at least we're getting
Yeah.
somewhere, and that's the
Yeah.
point. All right. So we're so thankful, Ms. Myra Pinelo-Fernandez, and of course Dr. Natalia Bear. We're so thankful that you guys could have joined us this morning to share with us the latest on COVID-19. Thank you.
Thank you.
Thank
Thank
too.
you. Thank you very much.
All right.
All right. April, guess what we've got coming up next?
Last segment.
It's the last segment, and it's all about the Woodstock Benefit Concert. How can you be a part of it? When is it going to be? Where is it going to be? We've got the folks in to tell us all about it when we come back. Stay with us.